Right. But again, you're 100% right. Like not everybody's created the same way. So get your levels checked. And I love how you said, it's true. We have to pay for it out of pocket, but it is so worth it because now you're going to have an efficiency in dosing because what if you're like taking too much, right? Then you're actually wasting money and your body might suffer from it.
You may be familiar with the vitamin D because it's known as the sunshine vitamin. What does that even mean? It means that we need sunshine to manufacture it. And how do we do that? When the sun hits our skin, we make vitamin D. Now, if we're wearing sunscreen, what happens then? Do we make vitamin D? No. Do we make enough if we're wearing clothing? No, we need at least like 30% of our body exposed in order to manufacture enough vitamin D for the day. So in our climate and where we are relative to the equator, we're all often quite deficient if we're not taking vitamin D. And can you get vitamin D from your diet? Well, a little bit from salmon. You'd have to eat lots of pints of mushroom.
It's not enough. It's not enough.
So not enough. The bottom line is a no. So vitamin D is something that they've found is so important in so many levels. Your immune system needs vitamin D. Your bones need vitamin D because it helps to absorb calcium. And fascinating, it's actually we've seen in research that it can impact pregnancy. And if your levels have been found to be less than 20 nanograms per mil on blood work, they had found that there was an association between that low level and first trimester pregnancy loss.
And we speak to this. I just want to add in that I don't want to forget that when we spoke to Dr. Kim Garbedian, who's a fertility doctor in Toronto and the medical director for pollen fertility, we talked about recurrent pregnancy loss and how vitamin D is very important. And there's way more research about it now with regards to that specifically. So super exciting. And as you mentioned, I don't know, I think it's like 75% of people in North America have vitamin D deficiency. So it's a no-brainer. It's like, take it.
Right. Yeah. So being deficient in vitamin D could be detrimental to early embryo development. And the study the review was of over 10,000 pregnancy outcomes. They were looking at that many pregnancies to see the association. So they don't really know why or how it works, but that's the suspicion that it actually impacts embryo development. It could even go as far back as like follicle development or egg development, right? Not just the embryo. So I would say that if you are planning on conceiving, it would be good to get your levels tested, especially if you have not been on vitamin D, to make sure you're at least above 20, but more optimally above the 75 range, because above 75 is considered normal. So 75 to 250.
I want to go back to what you said about, we're all like we worry about skin cancer. I think back in my day, like people were putting on baby oil and like sitting in front of like it was insane. But now we've completely gone the other way, right? Yeah. I know when I go out, my husband's like, oh my gosh, you look so Chinese. And like, I'm like, what? For real? So,
the hats. I guess I look Chinese because I wear hats too.
I wear the rim hats and I'll try to wear like a longer sleeve. And yet simultaneously, it's like, no. So I actually now wear no sunscreen on my arms and legs while I go out. Like, because, how long am I going out? I'm not going out for that long, right? So it's like, I want that sun exposure, but I still cover my face. I'm not going to lie, right?
And the neck and chest.
And the neck and chest.
We care about aging because that really 100%. Does. It's one of the most powerful things you can do to prevent aging skin of your face, your neck, your chest is to wear sunscreen and hats. So, but I do the same thing. I wait 20 minutes and then I put my sunscreen on my arms and my legs. So I get that 20-minute exposure first. And I like the heat on my skin. And I figure it's okay if my arms get all freckly and age a little bit.
Yeah.
It's okay.
So I guess the question then is like, now if we're teaching people to get better vitamin D in their habits going outside, is it enough?
So it is enough if your levels are healthy and you're maintaining. So what I'll say to patients is if you've been taking vitamin D all winter long, it's now spring, sun's coming out more, the days are longer, then you could probably get away with either a lower dose of 1,000 units a day or get off of it if you're, let's say, you've worked up your levels to a higher end of the range. Now, OHIP or Ontario Healthcare does not cover the test, so it would be something you'd be paying out of pocket to analyze. I think it's worth it.
Yes.
I personally prefer to know how am I doing with my vitamin D? Am I absorbing it? Am I taking enough? So through the summer, you can get away with 0, depending on how much sunlight you're getting. And but that exposure is like a dose. It's like 20 minutes out in the sun, 30 to 40% of your body exposed. That's like one dose for that day.
Right.
So you might have rainy days. You might have days where you're not getting out because you're working. So there are a lot of factors. So it helps to have that kind of 1,000 unit kind of low dose through the summer and then a little bit higher through the fall.
What does that mean? Little higher?
Well, I personally recommend, but that again, you should really be seeking care from your healthcare provider to ensure that this is, makes sense for you, because there are issues with overdose as well, which we can talk about. But I usually say, generally speaking, 1,000 units through the summertime, and then fall, winter, 3,000 units.
Right. But again, you're 100% right. Like not everybody's created the same way. So get your levels checked. And I love how you said, it's true. We have to pay for it out of pocket, but it is so worth it because now you're going to have an efficiency in dosing, because what if you're like taking too much, right? Then you're actually wasting money and your body might suffer from it.
Right.
So then now let's speak to what happens if you take too much.
So too much can impact your kidneys and your heart, your blood vessels. They're kind of like, because it's fat soluble, it's toxic to your liver. It can cause side effects that you might not even know are related. So it's better to kind of keep it under that 250 range. Don't go higher than that. However, I have had patients who are a bit confused with dosing, because some vitamin D containers have it so that the whole milliliter is 1,000 units, which to me is a waste. You should be getting a vitamin D supplement that's like one drop gives you 1,000 units. So then they switched to one where one drop, still that little syringe is used, but one drop is 1,000 units. And then they're taking the whole milliliter, thinking that they're taking 1,000 units. And so we have to be very clear on dosing, because then the levels can go really high. And I would say that for those patients who made those mistakes back in the day when they were making those transitions, didn't really have obvious symptoms, but it's based on the literature that it can be toxic to your kidneys, your liver, your heart, your blood vessels.
Then from that, are you then saying, let's get the baseline blood work, and then later let's do another check to test what your levels are? So again, knowing how to dose, and do we keep the same dose? Do we change the dose? Right. And I also loved how you spoke to is like, so they can come in drops, right? So like when you buy the supplement itself, it's with a dropper, but are there other forms of vitamin D as well, like oral, pills?
Yes. So there are white tablets, there are liquid capsules. So really it depends on the person and what they prefer. I have noticed that the liquids seem to absorb in the gel capsules versus the white tablets. I haven't done any recent experiments to see, because I recommend everyone take the liquid or gel capsules. So I can't comment on it now. I don't know if they've improved the white tablets, but it could be an absorption factor, because
so interesting, because I'm just going to be fully upfront. Currently, I'm taking a vitamin D. It's in the white capsule. It's a powder in the capsule, and I feel actually more energetic on it. But
so that's a powder in a capsule. That could be in a fat soluble powder. So that's different. Those white tablets, though.
Oh, got it.
When I was testing, I was like, I don't know, maybe the patients coincidentally had absorption issues, and that's why their levels weren't higher or better than the low levels that I tested. But I switched over to either the gel capsules or the powder in the capsules, or the liquid drops are my favorite. So because you can dose higher and play with it a little bit easier versus, swigging back a whole bunch of capsules. So lots of different ways to take vitamin D. And your question was, would you what would you recommend testing? Like how would you test, right?
Right, exactly.
So
Going back
I would,
to that.
so I would recommend testing in the spring after being on vitamin D all winter long. If you don't want to get a baseline before the winter starts, kind of jump into, if you've never taken vitamin D, go on that 3,000 units and then check in the spring. And sometimes people don't have like high levels in the spring, even being on 3,000 units a day, because they're coming in at such a low number, they've never taken it before. Mm-hmm. So it really depends on the person. But if someone's been on 1,000 units for a while, it's good to get a baseline and see where they're at. If they've never taken it, just get on it.
Right. And then, so let's speak to, we're talking about fertility and pregnancy, but really vitamin D is essential in your whole life. So let's go through that whole reproductive lifespan for a woman, and perhaps even add in the boys too.
And infants, right?
And infants. Yes, absolutely. Yeah.
Breastfeeding infants. Yeah. So the lifespan. So why don't we start with infants? So infants, if they're breastfeeding, should be on 400 units of vitamin D. It's very important for bone development and their immune system. And so it's the only supplement really we give if you have a breastfeeding baby, unless they have colic and other issues, which we can get into that some other time. And then going to the mom should be taking, they can continue their prenatal, which usually has about 1,000 units of vitamin D in it, and top up with a little bit extra to keep their immune system sound while they're, having those sleepless nights breastfeeding their baby. And if they're not breastfeeding, still continue as the mother. But the baby, if they're getting formula, usually that's fortified with vitamin D. So you would give additional levels of vitamin D. And then moving through, back to like just standard, the postpartum into the toddler years, once they stop breastfeeding or getting infant formula, you can still give babies, both boys and girls, 400 units is the standard, depending on their diet and how much dairy they're getting, because you can get vitamin D fortified in dairy, right? So milk. And then as adults, we really should be regularly taking vitamin D and checking. And in our perimenopause years, our demand for vitamin D would be definitely like higher. So if you haven't been taking it, it's so important because your bone density, you get that last hurrah before you stop menstruating. So it's really important to get enough calcium, vitamin D, to absorb the calcium, and before your hormones are no longer being produced by your ovaries.
Right.
You would want to make sure your bone density is, getting a good level of calcium, and you need the vitamin D for that. So
preventing osteoporosis, helping bone health in general.
Correct. So as a young woman, let's say you're now in your 20s and you're thinking about or let's say late 20s. I mean, nowadays we have children a little bit older. So later 20s, early 30s, you really want to make sure your vitamin D levels are sound and sufficient, because there is research to show that if your levels are low, that you could have issues with embryo development and miscarriages. So definitely want to get on vitamin D if you're, and even in general, like you're away at university, perhaps, or college, and you're studying and you're with a whole bunch of people in a dorm, and, COVID and other viruses, the 200 other flus going around, it's very important for your immune system. So you want to keep your vitamin D levels healthy. And I see clinically when people take vitamin D after never taking it before, they'll have a winter where they don't have colds and flus the same frequency as they used to. So we'll test and they'll say, oh my goodness, your vitamin D is like super low, less than 40. And they'll get on vitamin D, perhaps zinc, depending on what other things are going on. And their immune system's so much better the next fall winter. Or so chronic anything, chronic yeast infections.
Oh, right. Oh, that's a good one. Okay, cool. So basically, just to recap, because we need to finish up. So it's like it really helps you from birth all the way to like the end.
Yes.
Right. For many different reasons, from autoimmunity to like reproductive health to bone health, skin health, like, everything. So just do it and consult.
And one other cool little tip is if you forget a day, because people always worry about getting enough and taking it regularly enough, just vitamins in general when they're on them, is if you miss a day, you can double up, because the fat soluble vitamin there's only 2 vitamins like that. You can't like double up on iron, you'll hurt your stomach.
Right.
But vitamin B12 and vitamin D, if you miss a day, you can double up the next day.
Okay, cool. Thank you for that tip. Awesome. So if you have any more questions with regards to this, or if you want to hear another show with something specific that you have questions about, please DM us at Alive Holistic Health. And that is on Instagram, Facebook, or just contact us directly at clinic@aliveholistichealth.ca. And we shall look forward to seeing you guys real soon. Check out our show notes for some of the information.